Welcome everyone. Today we're back with another video regarding Jewish medical ethics. Today we'll be taking a slight detour. We've been discussing Shabbos and residency up until now, but I think with the incoming students going into school and anatomy labs just around the corner, it'd be nice to just take a break and discuss anatomy dissection and halacha.
So our goal with this presentation is really just to take a skin deep dissection into some of the classic sources. And honestly, the real reason why we kind of switched our programming for this week is that someone asked me a question. And this is going to be kind of an every yes. So the question was posed as follows. This was a real question that was sent kind of just a couple of days ago. And it was at one of the pristine, medical institutions here in the tri-state area. Moshe, if you don't mind reading our vignette.
Sure. So we have Kavermi Arp is a scholar and gentleman. He likes to sip a fresh batch of cold brew in his free time while watching the sunset over the clear waters of Cancun. He's an incoming medical student and will wreck the grading curve at the institution that is lucky enough to have him. He received an interesting email from faculty and has a shaila. Is a Jewish student allowed to dissect the body of a Jewish body donor for the sake of medical education? Continuing with this line of thought, is future Dr. Arp allowed to watch the dissection of a Jewish cadaveric donor? And does medical halacha have any other guidance or restrictions concerning anatomy dissection?
All right, so the names were just kind of changed to protect the innocent. And so really to phrase it, we have two basic questions. One, is a Jewish student allowed to dissect the Jewish body? And two, are you allowed to gain derived benefit from watching the dissection of a Jewish body? All right, and otherwise, are there any kind of halachic recommendations when you're entering the cadaver lab? So why do we do dissections? There are a few different reasons for postmortem interventions, so to speak, on cadaveric bodies. One is the study of anatomy and pathology. As incoming medical students, you want to really understand the human form. You want to understand all the nuts and bolts, establishment of cause of death. This is kind of in a postmortem situation where you want to understand why a patient passed on for reasons of medical inquisitiveness. Three is medical research. The progress of science really is by understanding the conditions and etiologies that may present. Four, there might be a forensic value to understanding cause of death in a case of potential foul play. And five, for organ retrieval for transplantation. Today we're just going to be focusing on the first one, which is the study of anatomy and pathology. And we're going to basically phrase the dynamic tension between values when respecting the human form and by deriving benefit, some great values of benefit, and how do we balance potential competing values. So just to give a brief historical perspective, in general, when I look at some of the basic sources that are now under the umbrella term of medical halacha, it's really important to understand the history, understand each response to as it comes in its historical time frame, and it really is quite poignant when looking at this topic of dissection, because you're going to find that there are different generations where this and similar questions really kind of exploded on the scene of halakhic literature, and others not so much. And the basic history is as follows. The Greeks and the Egyptians did a lot of anatomy dissection. Anatomy is actually a Greek word. Anatome means dissection, and omi is just the study of. So it's the study of dissection fundamentally is what anatomy historically was for a lot of history. The Romans had a strong taboo, and later kind of the Roman Catholics had a strong taboo, which kind of shaped the Western world's approach. So really from the fall of Alexandria all the way through until the Enlightenment, there were no cadaver dissections done. It really wasn't practiced. And that actually kind of has a funny implication on the history of Western medicine. In Western medicine, kind of Galen never actually dissected a body. A lot of his anatomy came from either gladiators that he treated, or it came from animal dissections. And so a lot of kind of misconceptions would come into Western medicine for hundreds of years because of a lack of dissections that were done. But that also means that you have a big explosion of some literature kind of around the earlier time period, but then you don't really have this concept of dissection come up until really the Enlightenment starts, 14th, 15th, 16th, 17th century. And it's kind of interesting to read. There's a brief little synopsis of some of this history in the Dr. Steinberg's book, the Encyclopedia of Jewish Medical Ethics. Highly recommend, highly good read, very informative, and really a great starting point for any topic in medical halacha. There's a interesting history. And you'll find many times in Shasti, and the Chacham will talk about the human form. One prominent example is in Safek Brachos when we say Krishma has 248 words to Krishma, and they correspond to the 248 limbs of the body. And the question is, wait, how did the Chachamim come up with their count? The Chacham were also were very specific, saying that there were 365, I apologize, 365 ligaments and sinews in the body. So how did they come up with their anatomical knowledge? So one possible way was actually empirical evidence. There's an interesting story. The students of Rabbi Shmuel was a Tana, had one of the big schools of Tanaim before Rabbi Akiva. So this was around the first, sometime in the first century. And the story goes, is said in the name of Shmuel. The students of Rabbi Shmuel had to boil a harlot. What was the story? The background was that the king condemned her to death, and so that her punishment was, after she was killed, she had to be boiled. The king was really important to the king that the Jews would make sure that the body was totally disintegrated. The Ben Yehoyada remarks on this story. He says that it sounds like that the king had this proclamation that she had to be boiled, and therefore the students of Rabbi Shmuel decided that they're going to learn something from this, to try to derive some benefit from this very sad occurrence. And so they come to Rabbi Shmuel and they ask the question, and we found that this woman had 252 limbs and not the 248 that we normally say. And so Shmuel says, Rabbi Shmuel answered that women actually have a couple of more limbs, just the way it was counted. All right, interesting story, and it shows that there was some appreciation in the Jewish sources, in contrast to the non-Jewish sources, to the practice of dissection, even though it definitely wasn't widely done. All right. So whenever kind of approaching a subject such as this, you can see that there sometimes can be competing values. So one value that we have in Judaism is obviously the treating life as sacrosanct, and having the sacred nature of human life. Its values override other religious values, and that's brought down. That kind of the way this is learned in the original, in a lot of the sources, is that you have religious values, but the religious values are all secondary to the value of saving human life, and that human life needs to be a religious value above all else. All right, so from there we can see that potential actions that will take a person towards saving a human life, like the study of anatomy, that has great value. On the other hand, there's a prohibition against desecrating the deceased, and this is brought down in the Chumash Dvarim. And this comes from after capital punishment. There was a practice of hanging the body up for the community to see right in front of the Beis Din. For more on that, you can kind of read the Rambam that deals with some of this practice. But the halacha was that it needs to be done for a very short time, and it couldn't be left over all night. And the way the pasuk phrases it, for an impaled body is an affront to God, or in the Hebrew, Kikilas Elikim Tali. It's a curse to God, the fact that the human form is desecrated and disrespected in this way. The Rishonim deal with this in a couple of different ways. Rashi says, why is this a curse to God? He says because man was created in God's image, and the Bnei Israel are the sons of God, and therefore, if you're going to take the Son of God created in His image, and you're going to hang him and desecrate his body, you're by the way also desecrating the King of Kings. You're desecrating Hashem himself. All right. So Rashi kind of learns this, that specifically this is to do with the Jewish soul, and that the Jewish body therefore is sacred. Being that the Jewish body is sacred, you can't disrespect the Jewish body because that's tantamount to desecrating God himself. The Ramban takes a slightly different approach, and he reads it much more humanistically. And he says, it's almost like this case is where you have two, he's quoting a medrash. He says you have two twin brothers. You have one brother that becomes the king, and the other brother that is not the king. The king finds out that they're going to desecrate the second body of his twin. He says, no, it's going to look terrible. Why is it going to look terrible? Because he looks exactly like me, and you're taking my form and you're desecrating my form. And he says, and it's not like our teacher Rashi said that it's only referring to Jews. And he says when Yeshua went into the land of Canaan and he fought war against the kings of Canaan, and when they passed on, he made sure to bury their bodies. He buried their bodies because all human form is divinely inspired. And we're all created in the image of God. And therefore, all the bodies of all mankind are therefore sacred and need to be respected. So here we have a philosophical difference that turns into a pretty prominent legal difference between Rashi and the Rashi says that this really only applies on duress level to Jews, and the Ramban says no, it applies to all humans, the human form itself, because as Bereshit says, we're all created in God's image.
So just to frame things a little bit, it sounds a lot like our conversation really mimics Shabbos just from the beginning, in terms of like the same way we have a prohibition against transgressing Shabbos, we have the prohibition of transgressing and violating a body. And then the counter argument would be that in general, the Torah always provides us for ways to live and the promotion of life. And so if there is the value of promotion of life, these two things may contradict each other. If desecrating a body the same way desecrating Shabbos may promote the value of life, then the question is what trumps what. And I would just say in terms of the Rishonim, Rashi, and the Ramban, it seems like just like you said, humanistic forum and just like Kabbalistically speaking, it mimics a lot of what we say elsewhere in terms of that God never wants to destroy life, regardless of how one may live their life and whether or not they keep true to the values that God wants them to keep. Regardless, life is a beautiful thing, and its desecration is something to take into consideration because in its sense, we're an extension of God, and it's sort of like desecrating God. That's it seems like where these sources are coming from.
Yeah, definitely in the Ramban, you can definitely say that. And there's kind of an interesting parallel. Whenever the Jewish verses get more mystical, you find that they also become more humanist, which is kind of funny because you think in the general Western conception of religion, the more mystical it becomes, the less humanistic it becomes. But you'll find that authors like the Ramban, Arizal, they end up valuing life and beauty also as well. There's kind of like a sanctity to other humanistic values as well, which is definitely something interesting to explore. So I think part of exploring these topics is to understand not only what our Jewish values are, but to also understand how they can influence and how we can make a bridge between kind of the professional side of ourselves as well as our Jewish traditions. It's really important to figure out how to give a voice to our Jewish values in the professional area, because firstly, these Jewish values should be a light not only to us, but to all those around us, and also we shouldn't live our lives so so fractured that the Jewish side and the secular side are completely different. That sounds like a dissonance that can be uncomfortable. So we're gonna see that there's the value of human life, and there's also a value of sanctity. Sanctity doesn't really come up as much in secular values, as we'll see in a second. But one possible bridge between this conversation and a kind of secular level conversation is that even though the body of the deceased, the person has passed on, still their loved ones are still there, and by desecrating the body, you may bring grief to those those that are still alive. And I guess in a way, one way to phrase this conversation is how do we care for those that are still grieving, in the context of making sure that we deal with their loved ones even after death in the most humanistic and sensitive way possible. And so what are general principles of secular ethics? And these are the 4 principles, and most kind of ethicists these days use our principalists, so to speak. They use these 4 principles. So one is the principle of autonomy to respect people's choice. The second is the principles of non-malfeasance, which is to do no harm. In this case, don't do harm to the grieving loved ones. Principles of beneficence, do some good, and the principle of justice, which I think in our conversation can be don't eat Ben and Jerry's if you're listening to this recording.
One thing I would say, just in terms of how you relate our Jewish ethics into the non-Jewish these principles that are widely accepted, I think you make a great connection that we often think of like Jewish principles being totally separate from non-Jewish principles, and they operate so differently. But I think you make a great connection. The reality is that even when we discuss things like palliative care and we look at the support system for someone who's going through a difficult time, we also look at how the families are doing and things of that nature. And so that's exactly what this conversation is. I mean, aside from the fact we have the respect for the person who actually passed, we are valuing the life quality and honor of the body for the people who currently survive that person. And I think that's a really great way, because a lot of things we discuss in general are hard to connect and discuss in public forums because it doesn't necessarily fit the conventional principles. But I think that you really kind of nailed it on the head right there, and I think that's a great way to discuss it if one were to discuss it publicly.
Yeah, and I definitely think it could fit kind of you can fit some correlates into these four principles, but there is a fifth principle that the most religious cultures will have, and that's the ethic of sanctity. So if we're going to be honest, the real reason why in the Jewish sources we're going to respect the human body is because we treat humans with a certain amount of sanctity, the sanctity that we ascribe to the individual, because individuals are created in God's image. Even after death, the image of God is still present, and therefore, to respect the life that was lived, the life of the human, even after, even post-mortem, needs to be revered. But yeah, this can be brought down in various ways into the four principles of secular medical ethics. Okay, so now we have a couple of ideas to explore, and we're going to find that throughout this conversation, we're going to explore two basic ideas. And those are the two basic religious values that we kind of introduced this way. One was the value of human life, and the question is, we're going to analyze a little bit more. We're also going to analyze this idea of the sanctity that we subscribe to the human form post-mortem. And in Halacha and in Gemara, you find there are two angles that we take this at. One is that there's a prohibition against deriving benefit from the dead. That's to say, after a person passed away, you're not supposed to derive benefit from their bodies. Now, this benefit could be, germane. The sources talk about what sort of benefit this is, and the question is an academic pursuit. Is learning from the body deriving benefit? That's less clear. But there's one thing that's very clear, which is relating to the subject of today, which is dissection. The second Gemara says that you're not supposed to disrespect the body. Now, however, whatever your intention is, tearing a body limb from limb, as we do in anatomy, would constitute desecration, and kind of in a Halachik context. Remember, where we're deriving this is from the pasuk that says you're not supposed to hang the body. And even just hanging a lifeless body is considered disrespectful. Definitely dissection in our conventional way is going to be considered as disrespectful. Our question is going to be, are there moments in time that we're allowed to supersede that value? So just to bring this down, so we brought our Gemaras from Masechet Zara. Now we're going to bring this down to Shulchan Aruch. So Shulchan Aruch in your Dish and test, it says that the one who dies, whether they are Gentile or Jewish, they, as well as their shrouds, that's their burial shrouds and their coffin and caskets, anything that was kind of prepared for them, you're not allowed to use. All right, you're not allowed to use, you're not allowed to derive benefit from it. Okay, so it sounds like, so wait a second. Remember where we started the conversation with the Rambam and Rashi. Rashi said this only applies to Jews, and Ramban said this applies to Jews, non-Jews. So how does the Shulchan Aruch pass? The sources from the Gemara said we're not really clear about that. So the Pesach Tshuva is kind of a super commentary that kind of helps. It's on the pages of Shulchan Aruch, and it goes through the responsive literature of the 2 centuries that he covers, really from the 16th to the 18th centuries. And he says that when the Shulchan Aruch writes that both the bodies and the shrouds of Gentile and Jewish bodies are asur b'ana, he says there's a little bit of distinction here. Then he quotes this author, the Even Hashem, who I honestly haven't seen before, but he says that the implication of the Shulchan Aruch is not that they're both asur for the same reason. He says that the Jewish body is asur deraisa, like Rashi, and the non-Jewish body is asur d'Rabbanan. So deriving benefit has two different sources. For the Jewish body, it comes from this biblical principle of not deriving benefit, and we're passing like Rashi. And on a d'Rabbanan level, even a non-Jewish body, the Rabbanan said you're not allowed to derive benefit, just like you would a Jewish body, just like you would not be allowed to a Jewish body. All right, so now we kind of have this flavor a little bit, so to speak, for us. This idea of design and mass desecrating the dead on a biblical level, it applies to Jewish bodies. On a rabbinic level, it also applies to non-Jewish bodies.
No matter where you're coming from, at the end of the day, walking into an anatomy, lab would be an issue, just because we have Jewish bodies on the one hand being a biblical prohibition and non-Jewish bodies being a rabbinic prohibition. So that's sort of where this discussion really comes. That at face value, there seems to be an issue no matter which way you cut it.
No matter which way you cut it, but I do want to give an important preview, so, and I'm happy you brought that up. When we're talking about medical schools in the United States and Europe, really anywhere besides for Israel, the assumption is that not only are most bodies not going to be Jewish, but the body that you're going to be dealing with is 99.99% of the time going to be non-Jewish, unless specified otherwise. So, and this touches on a big concept in your day about Rive and how you look at statistical probability and how it influences this answer. All that aside, the assumption and the way you'd ask this question is that as long as you're in a medical school in the United States, or you're in the secular world, the body that you're going to be doing anatomy on, for the sake of the question, is not Jewish. Now, if for the sake of the question, your body for all intents and purposes is not Jewish, and that's how kind of this question is going to be framed. So just to be very clear, we're dealing with a rabbinic prohibition, and we're going to see, is there room to to kind of sidestep, or is there a way to relearn to better understand what the nature of this rabbinic prohibition is? And that's kind of where we're going to be going now. But to bring this into the context of our conversation before, really, so we did two ethical values, value of life, and the sanctity of the human form. Wouldn't the value of life supersede this ancillary value of the human form? In other words, we said that pikuach nefesh is an overriding sacred Jewish principle. So why isn't pikuach nefesh a sufficient justification? Wouldn't the saving of future lives by educating future physicians be sufficient enough to allow the unfettered dissection of the human body? And so we're not really the first to phrase this question this way. The case law surrounding this particular tshuva that we're about to quote is from the Neidiv Yehuda. This is from his Neidiv Yehuda, which his name is Rabbi Chaskolanda, but we all kind of know him in the rabbinic circles by his book name. And this is 200 year daya 210. So Shotrei Shiod. And so he was asked the question, and kind of the historical background also flavors the kind of the nature of this conversation. So a very common, very painful medical issue that you'd have kind of in Europe in the 16th to whenever we figured out that sanitation was important, was that people would develop these calcifications within their bladder. And these calcifications turn into these little stones. They'd be a source of infection. Patients would always feel like need to pee. It'd be very, very painful. It was kind of a developing, it's hard to call them doctors, but one of the treatments that, for all intents and purposes, that you get at the barbershop, and that would be the height of medical treatment back in medieval Europe, was they would try to go in, cut through the bladder, cut through the perineum, and get at it and take the stone out. Now, this was considered to be a very, very risky procedure. Most patients would die. And so the question came that they had a patient who they knew had this issue, and he passed away. So patient A passed away. Patient A had this issue. And their question was, okay, we don't have a patient B right now, but we want to get better at this procedure. Can we use this patient's cadaver to practice this procedure so we can get better at it and potentially help people down the road? So he answers, in this case, absolutely not. And so he says, in this case, you don't actually, there's no pikuach nefesh active in this case. You're saying that patient A passed away from this from a different cause. And now you want to use patient A's body to potentially help a potential theoretical patient in the future. He says that's not the way pikuach nefesh works. Pikuach nefesh is a much more parochial, much more local issue. Pikuach nefesh is where you have someone whose life is in danger, and you have the moral responsibility to save that life individually here. In other words, the way he phrases it, and the way it becomes phrased kind of in all rabbinic literature after that, pikuach nefesh only exists when there's a sick person in front of you. When there's a sick person in front of you, you have the divine, you have the mandate to save his life, but you don't have the mandate to save a potential life in the future. You may have a mandate; it might be a nice thing to do, but you can't use this legal mechanism of pikuach nefesh to override other issues. And he says you can't even use this to be over issur d'Rabbanan, which is kind of he really strongmans this. Now, this same sentiment becomes very clear in a tshuva from Ramesh Feinstein. We've actually quoted this tshuva once before, but it was about anatomy dissection. And the way it was phrased to him was there was a Jewish student. He was asking, "Am I allowed to dissect on a non-Jewish patient? Am I allowed to dissect on a Jewish patient?" So he says, "No." And he says, "You might say that you're going to gain, you're going to be able to do pikuach nefesh." He says, "You as an individual don't have pikuach nefesh in this moment. And you also don't have a responsibility to be prepared for eventual pikuach nefesh." And we quoted this last time. Just like you don't have a responsibility to make a tremendous amount of money so you can give a tremendous amount of tzedakah, so too you don't have the moral responsibility to pursue medicine so that theoretically you can be useful later on. The mandate of pikuach nefesh, the mandate to heal in the moment, is a responsibility for those who know how to do it. And therefore, I can't give you a heter to dissect a Jewish patient, a Jewish cadaver body for this end. I can't even allow you to be over an issur d'Rabbanan. And here we're actually dealing with issur d'oraisa.
It's just interesting how it manifests in so many different ways. That at the end of the day, we said it in other lectures, there's no moral responsibility to become a doctor. And so I think it's an amazing thing to become a doctor. It's an amazing thing to save lives. We all do it because we want to help people. Based on this, there's no more responsibility to become a doctor. It's just a moral responsibility that once you're a doctor, that you have that responsibility to take care of the patients in front of you. And I think it's pretty clear from these sources that's really where this conversation takes place. I think with our Shabbos conversation, we're always talking about the patient right in front of you. I think this conversation we're having today in terms of dissection is nice because it lets us step back and say, What about before you get there? You don't have any patients right now. What's your responsibility?
So yeah, in other words, the framing of this conversation is not about medical care per se, but it's about medical education. And the question is, can you use the same mechanism, saying that, for the sake of medical education, can we call it pikuach nefesh? And until now, up to this point, you say, no, absolutely not. Medical education does not equal pikuach nefesh. Now, there are other, so how do you expect it to be doctors? And that is actually a question that's brought in different places. Yiddishkeit, there is a dontological trend. So dontology is a Kantian philosophy, which is that you can't be in control of all the variables. So therefore, at least do the right thing in the moment. So Yiddishkeit does take some of this approach. And just to go back historically, this Noda B'Yehuda, the surgeons were not happy with Noda B'Yehuda in this case, and they said, you know what, you're harming our future patients. If you were actually to step back though and you appraise the situation normally, the surgeons, so to speak, were a couple of barbers. They were surgeons because they happened to have the sharpest knives in town. And the surgeons, they're very famous for having very dirty tunics, because the dirtier their tunic, and the bloodier their tunic, and the more human remains you have in their tunic, it proved the better and the more prestigious a surgeon you were. So people generally wouldn't die from the surgeries that they would do, which were violent and had no anesthesia. They would die though from the rampant infection, and it wouldn't be until Florence Nightingale that, at least in Western medicine, actually valued cleanliness and sanity, and with Lister, germ theory, and Pasteur later on. So arguably, the Noda B'Yehuda saved a lot of lives with this pronouncement. That's not to say that but he didn't know that he was saving a lot of lives. He was theoretically listening to the best medical advice of the age. But us as humans, we don't know. We don't have the blueprint of reality. And the assumption is that there is a blueprint of reality, and therefore sometimes we will just figure out, okay, does it fit within our legal construct or does it not? And we'll try to poskin based on that. All right, a little bit of a digression. So this question was phrased slightly differently, and based on a slightly different phraseology of the question, it was brought out differently in this next truva. This was written by the book name is called the Das Kain. This was done by Rav Kook. Rav Kook was actually a great grandson of the Tzemach Tzedek. So he was an old Russian Jew from a Hasidic background, and he became, I'm pretty sure, the first Ashkenazic chief rabbi of Israel. He had fascinating life, fascinating man, a fascinating set of philosophies, and this truva shows both his sensitivity, but also his pragmatism, which is really interesting. So this was in Sifreisim in Yerushalayim, and they were starting a Jewish medical school, or the hospital there. It's not really clear who exactly phrased the question, but it's clear that this is more of a societal question. They asked, are we allowed to use Jewish cadavers in our pursuit of medical knowledge? What's clear from the phraseology of the question was that for the first time in history, Israel was a Jewish state. The first time in kind of modern history, you therefore need to make medical schools, or medical education needs to be done, and you really only have Jews. Most of the Jews are going to be, most of the bodies are therefore going to be Jewish. So he says you have the moral responsibility to buy non-Jewish bodies, compensate them well, make sure it's being done willingly, and you're not allowed to use Jewish bodies. And so they came back and said, but wait a second, if we're only going to be using non-Jewish bodies, you're potentially causing a libel. And the libel is going to be that Jews respect Jewish bodies, but they desecrate non-Jewish bodies. And people are going to hate us for that. So he answers very pragmatically, and he says, I just read his Hebrew because it's so relevant to this day and age. Just those that want to hate the Jewish people, and those that are twisted with kind of the poison of anti-Semitism, you're not going to stop them from making more libels. There's no amount of Jewish bodies that you could dissect to avoid the next blood libel. And this is coming from a interesting point of history, that the time that he lived through and the time that he saw. This was very, very clear. So in other words, Rav Kook's answer is the haters are going to hate. That doesn't let you, dissect the Jewish body. How do you phrase this? How do you square this with the position of Eva? That maybe we'll do in a little clip. But yeah, that's his take on it. All right.
I think I don't want to be political in any way, but I think that does just fit with what we were experiencing over the past few months. It's quiet down now, but I think that's very much what we've seen in terms of what's going on in Israel. But I would also like to just ask, or really point out rather, that it seems like he's really not going with any issue of the rabbinic prohibition of a non-Jewish body dissection. Seems like
right. So he says you're allowed to use a non-Jewish body, and he doesn't really clarify in this tshuva, if I remember correctly, exactly why you're allowed to. Now, remember we said that that we were reading the Pesach tshuva to say that the Mechaber really holds like Rashi, which says it's only biblical prohibition by Jewish bodies, but non-Jewish bodies, he says clearly, though, that there's rabbinic prohibitions. How would he read the Mechaber and how would he read those sources? It's less clear from this source. From the next source that we're going to bring, though, we're going to realize that the rabbinic prohibition might have a different mechanism than the Jewish prohibition. And so this is kind of a tshuva that's near and dear to my heart. I sent it in last year to Rav Zilberstein's Kail. And the fun part for me was it's a SUNY downstate medical school, so you don't really see very often. First of all, English in some of these tshuvas, but it was really nice to see our school represented in the Halachik literature. And so this was a much longer tshuva. We'll put it in the show notes on YouTube. But so it's a 16-page tshuva, and it goes through a bunch of questions. Bizayin amas, nivel amas. It goes. It talks about how long are you allowed to postpone the burial of a body. It talks about what does a kohen do. So it's really a fun read. It's a long read though. So he phrases it differently. He says, based on a Chazon Ish, he says, when you look at the mechanism of this Issur D'Rabbanan about not disrespecting a non-Jewish body, he says the way the Chachamim set this up was they said, we really need to respect the life that was lived, the person. In other words, you need to respect the person as they lived through his life. And therefore, the assumption is that you also need to respect their dead body. On the other hand, in this case, where someone willingly donated their body to science in a non-Jewish context, you respect their wishes. So since the mechanism of the rabbinic prohibition against desecrating a non-Jewish body comes from the extension of wanting to respect their wishes during life as well, therefore, if they donated their body to science, it's fully allowed there's no rabbinical prohibition against respecting the body as they wish. This is kind of a fascinating angle, and I only really just brought the summary of his position piece. But he's basically saying that the biblical prohibition is that God views the Jewish body as being sacred, therefore we need to respect it. The non-Jewish body, on a rabbinical level, needs to be respected because you need to respect your fellow Gentile as well. Therefore, if by respecting them you're respecting their wishes, then you're totally allowed to. And that's a mechanism that he uses based on a beautiful little Chazon Ish. Again, if you want to read the full tshuva, the full tshuva is going to be there. All right.
Yeah.
So now,
mine actually. Can go back real quick. So it's interesting actually, just because now it seems like it parallels that ethical principle we were talking about earlier. It seems like it parallels it almost even more so now, because we're really concerned with the desecration of the body based on the person who had lived wishes, which is sort of like what we were discussing before about taking care of the living and how they feel. So even though we're putting it in the context of someone who already passed, it is still based on those feelings of whether or not there would be disgrace to that body.
So to phrase it slightly differently, when the Chachamim made this gzera, this takana, so to speak, of the Chachamim, and I know I'm mixing up words. Gzera is not the same as a takana, and that's not the same as nisr, but they're really speaking from a secular place. The secular value that you need to have is that of do no harm and of do good. And the way we're defining do no harm and do good here is by respecting your patient's wishes here. Which was really interesting to see. So this bridge is not a newfangled bridge, so to speak, between secular ethics and Jewish ethics. This is very much hardwired into halacha, and a general thesis statement for myself. But whenever you learn more Torah, the more you recognize how not only isn't there some sort of dissonance between Jewish values and normal secular values. The ways of Torah, the ways of peace, the ways of Torah are beautiful. And the more you learn about them, the more you're able to kind of take this beautiful tradition that we all have and really word it and give a voice to those values in our contemporary modern lives as well.
And then just to point out, so like Menachem briefly mentioned, if you notice at the top of this slide here, it says Harav HaChashav Rav Menachem Jacobs. He kind of modestly said, that he sent it in, but I just wanted to take a moment and thank him in front of everyone watching this video. And I hope that anyone enjoying this video realizes how much work he puts into this. Like you said, this was a 16-page published tshuva. He's constantly in touch with many Rabbanim regarding a lot of what we discuss. I can tell you from experience, sometimes he'll work on over 150 pages of sources before putting together a succinct slide. So I want to express how thankful I am. And if you're watching this video and enjoying, you should just realize how much work he really devotes to all this. And you can see that it's very updated. He's constantly in touch with a lot of Rabbanim, and it's really an amazing thing.
So I have plausible deniability here because it says Rav Chashav Menachem Yaakov. So I'm not My last name isn't Yaakov, so we don't actually know if this was me, but it was nice. There's some student from Downstairs School of Medicine who got this dribble. All right. Okay, so now we've kind of dealt with the background. We've dealt with some of the history. We understand that that as long as your body's not Jewish, that means for the sake of our conversation, as long as you're doing anatomy dissection in the Western world, you'd be allowed to. Does Halacha have any recommendations for a student entering the anatomy lab? And the answer is 100%. There are actually some poignant points that a student should take with them from the base measure, so to speak, into anatomy dissection. The verse is, as a firm Jew, you have a moral responsibility to avoid any kalos reish, any frivolity, the way we're going to define it in a second. And that is, we have a religious responsibility, as we've been talking about before, to really respect the donation and really respect the life that was lived, and really value the fact that we have this learning opportunity. So things that would be considered disrespectful would be to eat and drink in the cadaver lab. Halacha would recognize this as a cemetery, and just like you're not allowed to eat and drink in a cemetery, you're not allowed to eat and drink here. It says in Karen Bain Shem and Sham, so you're not really supposed to learn Torah or really learn anything else that's not associated with that, and associated with your studies in that place. Meaning, treat the anatomy lab not as a study hall, but as really the place where you're supposed to learn something specific with a certain amount of solemnity. You don't make any other calculations there. In other words, you're coming to the anatomy lab, you have a moral responsibility to be as respectful as possible, which, by the way, is quite difficult. And I've slipped up personally. You're there for many, many hours. Especially, we were double masked up with face shields. The whole thing was, and it's hard, but it's something to bear in mind. Another little point, which there's kind of an interesting way how I came onto this, but. If you're wearing tzitzis, you should try to tuck them in. Now, it didn't really come up with our anatomy lab because we were kind of wearing these massive smocks around our whole body, so everything was covered up anyway. But if you're just wearing scrubs, tucking your tzitzis is a good idea. I mean, it's a good idea. When I said this when I pointed this out to the people I was talking to about the Rabbanim I was talking to, they said the mechanism of the heter that we're giving you is really that we're assuming that all bodies are not going to be Jewish. If we assume that the bodies were going to be Jewish, we'd say you're not allowed to do the dissection. So tzitzis. You're not supposed to wear tzitzis because you're not supposed to be doing a mitzvah in front of a body because that's supposed to be embarrassing to the body. The body can't do mitzvahs anymore, and you can do mitzvahs. A non-Jew never had the chiyuv of mitzvahs anyway, so it's not disrespectful. But listen, even though the assumption is that your body is not Jewish, and especially in Tri-State area where there's 100 bodies there, and it turns out in New York Medical College, some of the bodies might be Jewish. It's a good idea to tuck your tzitzis. All right. The third and final thing that applies to everyone is after you leave the cadaver lab, you're supposed to treat it like with the solemnity of a cemetery. So wash your hands after we leave basic arts. We wash our hands. There's a certain separation between life and death that we need to keep, and kind of that's the last little bit. So we have a responsibility to be respectful. That includes potentially tucking tzitzit, and the other is washing our hands as we leave. All right, and that kind of finishes this off, and we'll finish off, I guess, with the words of the Mishnah Berurah, that defining what a basic car says, defining what a cemetery is. He says, it's a mesacha. Even if you're only going into one person who passed on, we treat this as kind of a cemetery experience, and we wash our hands as well. We're as respectful as possible, and I think that's a good note to end off.
I would just elaborate and summarize maybe real quick, because I don't know if we've discussed this personally. I don't know if it was so clear in this public discussion, but for the takeaway being that an average student walking into an anatomy lab somewhere across the country, when you approach your body, you can make the assumption that body is not Jewish, and with that, based on what we saw earlier, that would allow you to go ahead with dissection, not a problem. We're assuming it's not Jewish, and with a non-Jewish body, if they've donated it and you're giving the proper respect, you can go ahead and do the dissection without question. There's unless you have reason to believe there's Jewish, but you don't have to jump to any conclusions about that unless there's real reason to believe so. And that also was this discussion you were saying about tzitzis, was that if the heter that we're saying is specifically by the fact that when you walk up to a body, you can make the assumption it's not Jewish, then you wouldn't need to cover your tzitzis.